I'd like to bring in another guest now. This is Madeline Page from Right to Life UK. Now, your organisation has been actually concerned about illegal abortions in the past. What is your main concern with it? Might be an obvious question.
Well, it's obviously that it's outside the ramifications of the law, and similar to what Angela was saying, that a point, beyond 24 weeks, the baby is viable. We actually have babies surviving at 22 weeks. So what we're actually talking about is ending the life of an innocent child. And there can be also quite potential dangers for the mother as well. We now have women being able to have abortions at home. They can order pills over the phone. They'll never see a doctor in person. It's all done outside of that clinical setting, and they take a pill at home and have an abortion at home. And when that happens beyond 10 weeks, which is where it's currently legal, there can be some very serious dangers for that. There's actually been some freedom of information requests that showed that in just a 18-month period, about 10,000 women may have been hospitalised as a result of this. So I also have serious concerns for the health of the woman as well.
So what do you think about the latest guidelines here from the RCOG?
I think it's unnecessary. It's an overstep. The General Medical Council, so they're the regulatory body for doctors, they already have guidance for doctors, which shows that they need to, of course, uphold confidentiality, but in serious circumstances, then there can be reporting, and that is sufficient to allow a doctor to then make that judgment. It's not for a doctor to decide whether or not a crime has been committed. And as the doctor there was saying, they have a duty to the patient, so they can do that first, but they don't need to then also be withholding information if that's deemed to be really necessary. So I think this guidance is unnecessary. The existing guidance was good, and the guidance was actually written by or co-authored by Dr. Lord, who he's a medical director for one of the largest abortion providers. So he has a stake in this, and I think this guidance is being used by the Royal College as a way of campaigning and trying to change our laws rather than doing that through Parliament.
Okay, I just want to go to Ellie there, because you were shaking your head at one point. What were you shaking your head
Because I think what Madeline possibly doesn't appreciate is it is not a case of treating the woman and giving her sort of your priority and then sort of speaking to the police, because it's very crucial that any patient always has an ongoing therapeutic relationship with their doctor. With all doctors, with all healthcare professionals, they have that trust there. And if you treat her and then you are saying, well, we're then going to go to the police and prosecute you, we've sorted you out now, you're safe, but we're going to do this, you are breaking down that doctor-patient relationship, and that has massive ramifications for all of her future health. And that is absolutely sacrosanct, that we always need to protect with our patients. And that's why I personally would never report a patient in this situation to the police.
Madeline, do you appreciate that these women going in here, are women taking these measures, illegal measures, are in a really traumatic situation? They're not probably going to be doing it sort of without serious consideration, without acknowledging the dangers of it, and without any sort of trauma involved in it.
Of course not. Our abortion laws are already very wide, and as I said earlier, a woman can have an abortion for any reason up to around 6 months. So for a woman to be obtaining an abortion very late, yes, of course, there would have to be some really serious other circumstances around that. But ultimately, she is ending the life of a baby. And I think what hasn't been discussed is we're focusing a lot on prosecuting women, but actually I think we need to be looking at these healthcare providers, these abortion clinics that are providing this illegally and actually putting the mother at risk. And I would like to see, obviously women should be returning to appointments in person so they can be properly examined and we can see how far along they are so they're not put in danger. But also looking at how these abortion centres are regulated and why it is that they are offering these abortions in potentially dangerous circumstances to women.
That's a really, really interesting interesting perspective and kind of puts it on its head very quickly, because I really want to get to calls.
Yeah,
Dr. Ellie, would you report a clinic if you thought they were giving inappropriate abortion pills to people?
Absolutely, and that's what we should be doing. It's medical regulation. That is exactly what we need to be looking at, and not just in terms of abortion, of course, in all offerings of healthcare.
OK, to the calls now. Abby from Manchester, what do you think about this guidance that healthcare professionals don't have to or shouldn't report women that they believe to have had an illegal abortion?
To be honest, it's a bit of a tricky one, because you've got to think of the side of, for example, younger girls, like 15-year-olds can get caught up pregnant. Some people feel like it brings shame upon the family, being a younger age, being pregnant. So it's a case of they may want to kind of find something that gets rid of how they see a problem without anyone finding out. So it's kind of like a sacred trust, whereas the GP won't be able to do that, because obviously the family will find out and they'll be at risk of prosecution if, you know. So,
Abby, I'm just getting a reaction off Ellie out the corner of my eye. Sorry. And you want to just correct something?
Yes, we must correct. That's so important for viewers to understand that actually a girl of 15 can access terminations or any healthcare contraception as well, with a GP confidentiality without their family knowing.
But presumably, Abby, what you're saying is that some 15-year-olds may not know that. If they're not very good at their sexual education and have found themselves in a situation where they are pregnant, that they may also not know where they can go to get help with that. They may be embarrassed because of family and things, and then leave it too late and be in a situation.
There's a criminal aspect with that because they're underage.
Yes, there is also a criminal element to that, absolutely, but not what we're discussing here. Yes, Abby, I suppose you're worried about the younger people. Madeline, what would you say to that? If this is a person of 15, do you still want them reported to police? I mean, who is it benefiting, I suppose, is the question for you. Who does it benefit if a woman is prosecuted or punished for having a late abortion?
I would want to know more information about how did she end up pregnant at 15? If, as you say, you know, was there a power play in there? Was it a consensual relationship? There are a lot when it's somebody who's underage, and as you've already alluded to, there is actually a criminality potentially associated with that. Was that a consensual sexual relationship or not? And that adds a very important aspect to this decision.
Abby, thank you very much for your call and bringing that to our attention. Susan from Lincolnshire, what's your thoughts on this new guidance?
Well, to start off, it's what I already said to your lady. This girl that is speaking, she's got to get older and understand a little bit more about life, having children, and all the other things.
Susan,
she's still young.
We've got lots of women on the panel, so we're talking about Madeline. We've got lots of girls on the panel. You're talking about Madeline here.
I'm not sure what her name is because I turned my telly off, darling.
I think it's Madeline, Susan. So
the lady that's going on about abortion.
Yes. Well, okay.
Yeah.
That is the topic of discussion, Susan. But so what do you want to tell Madeline then?
I just want to say, sweetheart, just talk to older people, talk to and understand what life is about and why. Not just youngsters doing abortion, older people. She obviously a bit too young to be spouting on the telly.
Okay, hold on, Susan. First of all, we don't know what age Madeline is, and we have very young guests, and they know just as much, and sometimes more than the older guests. So let's not be too ageist here. But you don't think she has the life experience to be talking about this sort of thing. We're not talking about abortions, and Madeline is not saying that. What she is talking about is illegal abortions, so abortions that happen after 24 weeks. In that case, they are breaking the law, and whether they should be reported to police. And Madeline is saying, yes, of course they should be reported because a law has been broken.
No, I'm sorry. I think it has to be up to not to the police or somebody like her, some older person who can understand why these people, why these girls, why these women, why they want these illegal abortions. There's far more to it when we're talking about religion and all that sort of thing. There's far more to it than she seems to have been grasping. That's all I need to say,
Madeline,
really.
I'm just going to let you have a right of reply there because I feel like Susan was very much directing a lot of that to you. What would you say?
Okay, I'm not quite sure what it is that she's criticising or unhappy with. But I think ultimately, when somebody is having an illegal abortion, yes, there may well be other circumstances surrounding that. But what that lady has done was illegal. And it concerns me that actually there are abortion providers that will happily do that and potentially put her in jeopardy as well.
Can I ask Dr.
We need to finish it. Is it going to be quick? No. Okay, we're going to have to move on. I'm so sorry. It's a big break, this one. Thanks, Susan, for your call. Thank you for all your calls on this. Thank you for Dr. Ellie and for Madeline for joining us for that discussion.